ENT doctor and sleep expert. Sleep is something that I know that we all wish we had more of. I know I do. But our sleep health, for some has been a challenge during the pandemic. We've got, kids at school, but they're at school at home. Yeah. It's a challenge. So talk about first, how our sleep habits can impact our health.
So sleep is so important. And as you said, with the pandemic, I've got kids, and for the first part, when they all got sent home after spring break, it was a free-for-all, right? They didn't have school to wake up for. They were up really late, waking up really late in the day, sleeping in, and the sleep schedule was just decimated. I'm sure I'm not the only person that experienced that. But, we're kind of thinking about how does sleep affect health in two different subsets. In kids, it can really affect how their development goes and how their learning goes and their focus. And so when kids are at homeschool, they may, on the computer, they may not be getting the proper sleep because they don't have to wake up and get ready. They don't have that routine in the morning. And so their learning is going to be impacted for sure. Mm-hmm. For adults, when we don't get enough sleep, it's probably more detrimental. Our bodies are more fragile as we age. And so we're going to have things like increase in our blood pressure, decrease in our mental faculties, our ability to concentrate. We may have increase in weight gain and a lot of other things like that. So
yeah, so that COVID-15 or the weight gain during quarantine can also have an impact on your sleep.
Oh, for sure. Gaining weight makes you sleep worse because you have an increased risk of sleep apnea. On the other side, not sleeping enough can make us gain weight. And that can happen through two mechanisms. One is because we're tired, we don't get enough sleep, we're going to wake up tired. We're going to be looking for something easy to get that's going to satisfy that craving that we have. So we might reach for the bag of chips, we might reach for the candy bar, we might reach for something sweet, something not healthy, just to give us the boost. We might reach for something with caffeine in it to give us that boost. And a lot of those caffeinated drinks have sugar and things like that. And so that right there is going to predispose us to gaining weight because we're making poorer choices, trying to supplement our sleep. It's like having a credit card debt. You're never going to get out of that debt until you fully pay it. And we have to pay our sleep debt somehow. Mm-hmm. And a lot of times it's by supplementing it with things that make us feel better or feel energized temporarily. The other thing is we have hormones in our body that are regulated a lot by sleep. One is called ghrelin. That's the go hormone. That's the one that makes us have an appetite. One is called leptin. That's the one that says, slow down, stop, you're full. And when we don't get enough sleep, the stop, slow down, you're full hormone goes down and the let's eat hormone goes up. And so by process of elimination, we're going to be hungrier and we're going to eat more and we're going to make poorer choices because our judgment is impaired.
Mm-hmm. Really quick, if you have questions for Dr. Robinson, please submit them in the chat. We'll do our best to answer them as we go. And then Dr. Quimby is also going to be coming back live here with us briefly. So if you have questions for him, please do submit those now as well. Back to sleep. Is there a difference between quality versus quantity? So number of hours, when it comes to our sleep?
Absolutely. The number of hours you sleep is really not as important as how well you sleep. And in sleep, there's lots of stages, right? And you can all think about when you sleep, the stages, you're going to go through these, everybody does. The first 10 to 15 minutes, we call it stage one. You're kind of getting to that point where your body's relaxed. You're starting to almost fall asleep, but you're easily arousable, right? You might be able to snap out of that quickly. And then you move into the next two stages, stage 2 and 3. And you're gradually getting into a deeper and deeper sleep. What we really need is to get into that stage 3 sleep, that deep sleep, that restful sleep, because that's where our body can re-energize and rejuvenate itself. Mm-hmm. And then along with that, getting into that deep sleep, we get into the point where we can have REM sleep. And REM sleep is really important for restoration of our memories and rejuvenation of our bodies. And it kind of affects our immunity. All these types of things are part of REM sleep. So if we don't get into that deep sleep, doesn't matter how long you sleep, mm-hmm. you're not going to be feeling like you've had enough rest.
So we talked about kind of when kids got called back, or school was kind of not canceled, but they were sent home. Right. And what we're going to be experiencing the same thing or something similar with the holiday breaks. Yeah. So kids are going to be not in their typical sleep schedule. We've got, they're probably turning to electronics for entertainment because they can't really be with their friends, or at least, it's encouraged for them not to be. How can you keep your kids on a healthy sleep schedule, or when is a good time for them to really get back before they have to go back to the classroom?
That's a better question, because I was going to say, you're never going to keep your kids on a sleep schedule on break, at least in the beginning, because they're going to feel the freedom of mm-hmm. not being in school and not having to wake up at a time. But getting back into it, we already mentioned a little bit about sleep hygiene. Having a routine is super important, especially for kids, but don't forget that for yourself as well. making sure that they don't have electronics or a blue screen in front of their face about an hour before bedtime, letting their brains do what they're supposed to do. The melatonin production that comes through avoiding that blue light is so important, and that helps the kids start to feel tired, making sure they're going through the same steps that they might as they're getting ready to go back to school, brushing the teeth, laying in bed, reading a book, doing a story, whatever your home routine is, doing that routine. And maybe they're going to go to sleep a little bit later on the break time. That's fine. But as long as you're keeping the routine, it's going to be easier to transition back to the point where you have to wake up early and get to school on time.
A couple questions submitted live. Is there another way to prevent snoring besides strips and sleep studies?
There's a lot of ways to prevent snoring besides those things. The most important thing to remember is that snoring is a symptom. It's not a disease. And so the most important thing is we have to figure out why you're snoring. And we may not always know why, but the number one reason in Americans is sleep apnea. That's why the sleep study is so important, because we have to make sure you don't have sleep apnea. If you do, you have to be treated. Otherwise, your heart can suffer. So after we find out whether you have sleep apnea or not, then there's a lot of other options. We look at the nose, how well does air flow through there? We look at the mouth and the way your bite is and the way your tongue sits and how does that affect snoring? And there's a lot of things we can do to address those issues. That's a much bigger topic, I think, than we have time for today, but there's lots of things we can do to help with snoring. There's no cure necessarily, but there's a lot of things to make it better.
Now, if you are severely sleep deprived for weeks or even months, how do you suggest getting back on track? If you have been sleeping only 5 hours, is there a recommended way to move back to that 7 or 9?
Just start with baby steps. You're never going to go from 5 to 9. Like, that's just not going to happen. It's hard. Your body's in a routine. And so increase the amount of time you want to sleep by going to bed 20, 30 minutes early, and then just moving that up. And again, for adults, it really goes back to sleep hygiene, just like with kids. We have to have a routine. We have to let our bodies do what they're supposed to do. We have to let the melatonin work to make our body get those signals to start to shut down. And as we get older, we're going to sleep less. Our brain produces much less melatonin as we get older. As a lot of elderly people have issues getting to sleep early and then staying asleep in this deep sleep. And that's partially because of the decrease of melatonin. So routine is really important. And then talk to your doctor. There may be a role for supplementing melatonin in your diet.
Is it okay to nap during the day if I'm working from home? I guess it's probably a question of, is my mind kind of capable of being productive, or is it beneficial? I know kids take naps during school, so. Hey,
naps are great. There's been a lot of studies that looked at what we call power naps, right? And even in some countries, it's encouraged to take a nap. And there's, some places in Japan have like nap cafes. You go there on your break and you take a short nap and you go back to work. So naps are really great. It's not for everybody, but if you're getting into that, giving yourself at least a segment of time, 15 to 30 minutes, you're going to have a restorative experience. If you're giving yourself more, you might get into that really deep sleep where it's harder to be aroused. You might feel like it wasn't worth it, or you're going to feel tired throughout the day. So there's a sweet spot there, but I think naps are good for some people.
This is a question I've always wondered myself, because I am a night owl. So is it possible myself to become a morning person? Is that something that you can train your body to do, or is it just, something that you're either one or the other?
Well, that's a good question. Being a night owl and a morning person, I would say yes, it is. But again, it's kind of just that transition, right? I mean, for some people, their job or their lifestyle or their family circumstances require that they maybe are a night owl. Maybe that's when they're the most productive, because that's when they have quiet. Maybe that's when the kids are asleep. Maybe that's when, you have moments to yourself. And so for some people, they wake up early and go to work. It may be challenging to wake up like at 3 or 4 in the morning. Like, that's really hard to do. And so just looking at your own circumstance, looking at where you can carve out that time is important. Again, we talked about how sleep is like a debt. You have to make up that debt somewhere. And so if you're going to want to be a morning person, you're going to have to go to bed earlier. And you're going to have to do that through changing your routine and through really focusing on the priorities that you have.
So we talked about how gaining weight can affect our sleep, but can losing sleep make you gain weight?
Absolutely. So when you lose sleep, again, you're going to make more poor choices. You're going to be hungry. You're going to be looking for that pick-me-up. And so that may lead you to sugary snacks. That may lead you to caffeinated beverages that are going to have sugar in them. And that's going to potentially increase your caloric intake, which leads to weight gain. And then also it affects those hormones that tell you when to eat and when to stop eating. But if you're overweight, you're going to sleep worse, most likely, because you're probably predisposing yourself to having sleep apnea. If you lose weight, you're going to sleep better, almost certainly, because you're going to have a lower risk of sleep apnea. You're going to have less weight and pressure on your chest, affecting your lungs, how well you're breathing, affecting snoring, affecting how comfortable you can get during sleep. And so weight loss is probably one of the best things you could do for sleep. If you're looking for one thing to do, it's weight loss. And it's hard during the holidays. You've talked a lot about that with some of our other guests. You're going to have challenges, but focusing on that ultimate goal, the long-term goal, that's what's going to get you to better sleep.
Another question submitted live: is it better to stay on a schedule or get the sleep when you can?
It's always better to be on a schedule, but if you're a new mom, you're going to sleep when you can. Every circumstance is different, but you've got to find something that works for you. And the most important thing is that if you get off the schedule, you just live with it and you move forward. If you beat yourself up, you're just going to get into a cycle of never improving. So.
Last question. We have time for one more question. What are some tips for getting enough sleep? Maybe you're someone that doesn't really monitor your sleep very well, or needs some things to kind of encourage it, or like melatonin, or what are some tips that you have?
Yeah. So like I had said before, melatonin is a good option for some people. You should talk to your doctor before starting that. But that's something that can help, especially in older people. Sometimes it's hard for your brain to get to the point where you can relax. Just like as we talked about with kids, getting rid of devices, turning off the TV, turning off your phone. Don't look at your phone in bed. Try and make your bedroom a sacred space for sleeping. Don't bring those other things in there that are going to distract you. Reading is a much better activity before you fall asleep than watching a TV show on your phone. And I'm being hypocritical by saying that because I do that too. Everybody does. But if you're really having issues sleeping, if you're really having an issue with a routine and you want to get better at that, you have to have good sleep hygiene. You have to have a routine.
All right. Thank you so much for being here, Dr. Robinson. We really appreciate it. And again, this webinar is going to be posted on our website, so you'll be able to access all of these live Q&As later on after we are done.